Patients who have had bariatric surgery or weight loss surgery frequently come for consultation with a plastic surgeon 1 to 2 years after their bariatric surgery. They've often lost 100 to 150 pounds or more, and as a result, they may have loose skin or problem areas in the face, arms, breast or chest, abdomen, buttocks, inner and outer thighs. It's very important that they've reached a stable weight. When a patient is in the process of losing weight, their protein stores are depleted, and this is not a good time to undergo elective surgery such as plastic surgery. Once the weight has been stabilized for 3 months or more, we can begin the process of removing the unwanted skin. Typically, patients will have multiple areas of concern, and on our initial consultation, we like to make a list of all the areas the patient is concerned about. From that list, we can develop a priority of things that are more important to the patient. Once we've made that prioritization, we can combine multiple procedures, typically 2 and possibly 3, to be performed in one time. In order to do this and maintain safety, we need to limit the time under anesthesia. This is important because the anesthesia gases themselves can build up over hours and hours, but additionally the patient can become cold during the surgery, which increases the risk of wound healing problems and infection. In order to do the most number of procedures possible in the least amount of time, I like to involve my brother, Dr. Ernest Rehnke, in performing these operations. He is a very talented general surgeon who specializes in bariatric surgery and is familiar with these kinds of problems. He and I work together as a team in order to perform more procedures in a limited amount of time. Quite commonly, we like to combine abdominoplasty with inner thigh lift, or brachialplasty and breast lift. A brachialplasty is a procedure which removes the excess skin along the upper arms and armpit area. The scar runs between the biceps and triceps muscle and into the armpit area. It can have an extremely dramatic effect on a person's arms and is one of the procedures that patients are the happiest with. It's easy to combine this operation with breast or chest surgery. This operation, such as a mastopexy, is performed to lift and tighten the breast. It's much different than a standard plastic surgery breast lift, and this is because when a patient has lost so much weight, the breast can be completely deflated and sagging even down to the waistline. This sort of problem requires a special procedure, and we have developed procedures in plastic surgery that address the weight loss patient for just these sort of problems. They're referred to as extended mastopexies and can have a very dramatic impact. And really, just about everything that we do in plastic surgery applies to the bariatric patient. However, their needs are much greater than the typical plastic surgery patient. And so the operations we use need to be specialized for them. And this is why it's important to find a plastic surgeon that specializes in post-bariatric surgery